Welcome to the video of Newborn Assessment, where each newborn is carefully checked for signs of problem and complication. My name is Sabra, BSN 2-1. Of the newborn assessment is to check each body system for health and for the normal functioning, and for the detection of any problems in the earliest and most critical stage.
For the materials, we will be needing a gloves, stethoscope, pen light, and a measuring tape.
Before we start any procedure, we will make sure to introduce ourselves to the client. In this case, we'll be introducing ourselves to the post of mother. And of course, to identify the baby's identity, we will be checking the ID band of the mother and of course the ID band of the baby to make sure that it is matched. And second, to provide privacy to the client and of course, document all the findings in the newborn's record. For the birth weight, weight is an important indicator of health. An average full-term baby is about 7 pounds. And in general, a small and a relatively large baby is a greater risk for a problem. For the other measurement of the baby, this includes the head, chest, abdomen, and the length circumference of the baby. But this procedure is being done after the birth of the baby. But in case that we might need to ensure the measurement of the baby, we will proceed by doing it so. But first, we will do our hand hygiene and of course our gloving technique before touching the baby.
For the measurement of the newborn, we will be starting for the head circumference, or the distance around the baby's head, and its normal values are 34 to 35 centimeters. For the chest circumference, it is the distance around the nipple line of the baby, and its normal values are 31 to 33 centimeters or 2 cm less than the head. For the abdominal circumference, it is the distance around the abdomen, which its normal values are 31 to 33 centimeters. And lastly is the infant's length, which is normal value of 50 centimeters.
For the vital signs of the newborn, we will be taking the temperature, heart rate, and the respiratory rate of the newborn. But be careful when doing it so because some baby are very irritated, especially when we are touching them.
For the assessment of the vital signs of the newborn, it includes the temperature. It is about 36.4 degrees Celsius, but it can vary slightly. A high temperature is usually considered to be 38 degrees and above. And normally, for the respiratory rate of the newborn is about 30 to 60 breaths per minute. For the heart rate of the infant to 12 months or the newborn period, it should be 120 to 160 beats per minute.
Next assessment that we'll be doing is the general appearance of the newborn. In this, we will be assessing the physical activity, the tone, the level of consciousness, and the posture of the newborn. For the overall skin color of the baby, we'll be assessing if the baby is cyanotic, pale or yellow or jaundice, and of course, if the baby have birthmarks or bruises around the body. For the head and neck assessment of the newborn, we will be checking for the appearance, shape, and presence of molding of the baby's head, or it is the shape of the baby's head from passing through the birth canal. We will also be checking the fontanelle or the soft spot of the baby's head, or in the baby's skull. And of course, for the neck, we will be checking for the presence of the vernix, which is very common in the neck area. And of course, we will be checking the clavicle. It is the bone in the shoulders of the baby. For the assessment of the eyes, make sure to dim the lights of the room for us to avoid opening the eye of the baby and for us to easily identify the dilation and the activity of the eye of the newborn with the use of pen light. assessment, make sure to check both of the left and right ear. Some condition of the baby or the newborn only have one ear. That's why it is important for us to check both of the left and right ear of the baby. For the nose assessment, this assessment is very important because as a newborn or a baby, they are known to be a nose breather, meaning they breathe through their nose. And by checking this, we will be occluding one nostril or one opening of their nose to see if there is an obstruction through their nose. For the mouth assessment of the newborn, we will be checking through the physical assessment if there is any lesion or damage through the skin of the newborn's mouth. And of course, we will be checking the cleft palate of the baby, if there is any or none. And of course, the sucking reflex of the newborn by inserting a finger through their mouth. For the next assessment is the LANUGO, or the soft downy hair on the baby's body. Take note, in the premature baby does not have LANUGO, but as they mature, they have this, and eventually when they post-maturity, they loses this LANUGO. For the next assessment, we will be assessing the arms and the fingernails of the baby. And by assessing the fingernails, we will be actually counting each and every fingernails that the baby have. And of course, with the arms, we will be checking for the arm if this arm reflex is good. The good reflex of the baby is newborn is like this and not totally down and relaxed like flat. For the next assessment is the legs and the toes of the baby. By checking this, we will be identifying the length of both left and right legs if this is the same. And for the toes, we will be counting each and every toes. Remember that when counting the toes, some of the newborn have excess fingers. And in this case, some cases are being tied, and in other cases, they are being surgically removed. Next assessment for the toes is the plantar grasp. It's what we do in the grip of the arms of the feet. And we will be assessing the plantar crease. These creases range from none or absent and covering the entire foot depending of the maturity of the baby. And lastly, for the toes is the Babinski sign. We will be checking this to see if the baby has this reflex. Next assessment is the genital area. In this case, we have a baby of female, and when we remove the diaper, we will be checking for the appearance and size of the labia minora and majora. In some cases, this depends on the maturity or the full-term or preterm baby. If this is a preterm baby, then the size of this or the appearance of this may be different from the full-term baby. And for the genitalia of the male, we will be identifying if the testis is already descended or if it's not, depending if the baby is full-term or a preterm baby. And of course, the appearance of the scrotum, if it is smooth or wrinkled in the skin. For a further assessment, in the diaper area, we'll be still assessing for the urine or the stool of the baby. In this case, if the baby is after of 24 hours of breastfeeding, we are expecting for the meconium or the yellowish or greenish stool that is sticky that will be coming out normally for a newborn. And when you are putting back the diaper on the baby, make sure to not cover the umbilical cord that is still attached to the baby. Again, the taking care of the umbilical cord of the baby is to not take it off. It will naturally fall off for the baby. And lastly, for the assessment of the head to toe of the baby, we will be checking the back of the baby. In this case, we will be checking for the spine, the back, and the booties of the baby or the buttocks of the baby, and if they have dimpling or any bruises around the body or the baby's back. All these examinations are important ways to learn about the baby's well-being. By identifying any problems with this, we collaborate with the baby's doctor to provide a plan for a possible care. Again, my name is Sabra of the SN2-1 and thank you for watching.